Hello, I am Paulette Mahurin, your host today at OurVentura TV, and I'm absolutely thrilled to have with us Lisa Safaeinili, who is the Executive Director of the Westminster Free Clinic. Every once in a while in our lifetime, we encounter something we never forget, something magical and moving, like the Peace Corps, or if we ever have the opportunity to sit at the feet of the Dalai Lama or tag along with Mother Teresa. It moves us in a way that brings out the best of the human condition. And today, we're going to be talking to an individual who has set up a group and works with people that are giving free service from the heart. And it feels like our own little Peace Corps in Ventura County. And before I say anything further, I just want to introduce Lisa to our audience. I am absolutely thrilled to have you here today. So tell us about what Westminster Free Clinic is.
Thank you for this opportunity to talk with you and tell others about it. Westminster Free Clinic is all about creating early access to care and also about having the next generation be part of the solution. So it's our vision that as we are helping our local community be well so they can work and care for their families, that we also have high school students who are mentored and work side by side with our volunteer medical professionals to help others, and it changes their lives.
Okay, now what this is free medical, it's free dental, it's free chiropractor, it's free eye exams, it's free legal, there's no copay. This is really, really free drugs, free pharmacy. These are doctors and dentists and lawyers that are in the community servicing people that the middle class has no access to. And how are you able to do this?
Well, it's really, there are a lot of amazing people in our county, and so these are doctors and podiatrists and dietitians and mental health counselors, all people who work at a full-time job, and then they come after their regular work to help out at the clinic and make sure that people they can't access at their normal work, they can give access to through our clinic. The people we serve at the clinic are the working poor of Ventura County. So they're people who are making too much to get free care through the federal funded type programs, but too little to afford to pay for care. And so they're kind of the ones stuck in the middle. And even with the Affordable Care Act, they will remain people who cannot afford co-pays and premiums just because of the cost of living in our area.
Yeah, exactly. I mean, this is probably one of the biggest political issues in our time, how to service the people that are falling into the crack. Now, every Wednesday, this magical, incredible thing happens. And if I hadn't seen it with my own eyes, I wouldn't believe it possible. But this huge, big church in East Ventura County changes over and sets up a working clinic that when I was there were 140 people waiting to be serviced.
Mm-hmm. Yes.
140 people waiting to be serviced, a ton of doctors, lines everywhere. I was amazed. And then at the end of the evening, the whole thing is broken down.
Yes.
Can you just run us through who comes, who does what, and how it works, and how people can find out about it?
Sure, yeah, it is pretty amazing, and the high school students are a really big part of that. There are 89 high school students who intern at our clinic. They're from East Ventura County high schools, and it's really inspiring because you hear all these negative things about high school students, but there are a lot of really cool high school students out there, and they help set up the whole clinic. So they take the privacy screens out. The Methodist Church lets us store everything there, and they take it all out. The carts are from Craftsman carts from that we just set up as medical cards, and they actually set it all up, and then at the end of the night they tear it all down. And then in the interim, all the volunteers, medical professionals come, and they know where to go, and we have scribes that are there for the doctors because we do have electronic health records. And so that way the doctors can spend all their time with the patient, and the students are assigned the patients. So the first 100 or more patients, depending on how many doctors are volunteering, are assigned a student, and that student takes the patient through the whole process. So they do the patient's temperature, pulse, respiration, they do the patient interview, and then the student takes the patient to the nurse to get their blood sugar checked, their blood pressure checked, and then the nurse oversees and makes sure the student did everything correctly and highlights what the student wants to share, what the student should share with the doctor when they go in.
Right.
And then they present.
Now let's say that's incredible,
Yeah.
and you walk in and you just see these teenagers, wall-to-wall teenagers wearing their scrubs. They all
Yes.
get their scrubs. They look
Yes.
like they're residents at Stanford or UCLA Medical School. I mean, it's incredible. Somebody comes in and you find out they're diabetic. Somebody comes in, you find out they're hypertension. They have hypertension. They go to the pharmacist, your pharmacist on site, they get free medication. Then what? I mean, then who do they follow up with? How do they get taken care of?
Well, the neat thing about Westminster Free Clinic is we're a medical model and a public health model combined. And so first and foremost, we have student promotores who are out in the community who do screenings for with a health professional for high blood pressure and high blood sugars, because a lot of times people aren't going to a doctor and don't even realize they're walking around with diabetes and they're having vision problems and they don't know why.
Right.
And so once they find that out, then they'll come to the clinic and they'll see a doctor, and the doctor will write a prescription. But also we have a lot of preventive things going on. So we have health education, we have a Zumba class, we have a train the trainer model. So we're training the people of the community that we're serving to also tell others and help their families then prevent having diabetes or high blood pressure by changing their diet, by exercising more, because a lot of times people just don't have information. So in addition to the treatment that we provide and labs and all of that, which is provided through donations and the community support of the community, we also are trying to prevent the future family members from having those same problems.
So this can create a secure feeling for somebody that comes to you and has a need, and this is where they get their medical care.
Yeah, we're their medical home. Yeah, and we
That's
try to be a community center
Yeah.
where they can get clothing. We provide food, fruits and vegetables.
I know that you had a full-staffed kitchen supplying the diabetic patients that were there waiting
Yes.
hours and hours and hours to get in, to be seen,
Yes,
healthy snacks.
yes.
You have local restaurants donating to you. You
Yes.
have, people can't help enough.
Yeah.
I haven't seen anything like this in Ventura County or anywhere at all in LA County. I know doctors that I worked with that teach at UCLA that go over to Thailand because they want to feel a sense of compassion for doing something that's Peace Corps or Doctors Without Border, and here you have that. Now, what makes it unique that you're able to have that sense of incredible community and heart-opening charity?
Well, what makes us unique is really the people who it draws and attracts to volunteer, and it is the same kind of people that would go out to other countries, and yet they can do it here in their own local community and go home at night to their warm bed. So it's a really win-win for them to be making a huge difference. Our patients are so grateful. Our students are so appreciative of they're treated like equals with our medical professionals, and they have grand rounds, doctor talks at the end of the night. So it's a special kind of person that the clinic attracts, and a special kind of student, I believe, that it attracts as well. Students who really want to see what they can do, and as teens are appreciative of being given an opportunity to really make a difference and see if healthcare is a career for them. But the other thing that makes us unique is that we are holistic. So we do, in addition to medical care, we are a training model for high school students, and we are trying to do prevention and get the whole community involved. The local Latino markets are amazing, working with our students and actually finding out, we'll offer skim milk instead of just whole milk, or instead of just sugary cereals, we'll offer some low sugar cereals. So the students are working in partnership with our local Latino markets, for
And
example.
you actually have a nutrition person. You
Yes,
have several
we do.
nutrition, dietitians, teachers that do classes right
Yes.
there. You had a row of seats lined up, and you had the classes ongoing,
Yes.
which is just, it's incredible.
Yeah.
So how does somebody connect with you? How do they actually get in and be seen? And what do you do if somebody comes in and they have an emergency and they need to be seen right away? How do they get into the system, and what kind of patients do you handle?
So first and foremost, they need to be a Ventura County resident. But the way they come is it's first come, first serve. Because often when you are low income and living on the edge, your ride may not show up, or your car may break down, or you may have a crisis. And so with appointments, our volunteers might be waiting and not have a patient show up. And we want to make sure we use the patient's time wisely, and also not stress out our patients by feeling like they didn't comply and come for an appointment. So they come when they can. And so those first people who come are seen. If we always have more patients come than we can serve, so we have way over 100 people who come, and so they get first priority for the next week. So as far as a waiting list goes, they will be called, their names will be called by 5, and then they can get the spots first, and then we fill in the rest.
What do you do if somebody is urgent or needs to be seen, or you have a sick baby? And you do treat all ages.
Oh, yes.
You're not just treating hypertension, diabetes. I saw little newborns coming in with their moms and breastfeeding, and some geriatric, elderly, senior, sophisticated patients. So what do you do if somebody really needs to be seen?
Children are always seen. So we always have a pediatrician there every week.
Great.
And every child is seen. Usually we can get them into the county system, so we're a bridge. So we're only there, and most seniors as well. So once they become 65, we can then get them into the system. But we're a bridge until that time happens, and we also often help them learn about what their health issue is to know why they need to go get more care. So with that, we serve people, mainly the working poor of our county. And
so they just need to show up.
They just need to show up. We screen
them. And how
them.
do they find out how to show up? Where do they show up? How do they get that information from you?
We don't seem to have a problem. There's a lot of people coming,
mainly
word of mouth.
Let's say, okay, so
and
we've got
referrals.
word of mouth for people that are watching now.
Yes.
So how could they find out where you are geographically and how to get there?
So we're in East Ventura County. We have a site for the homeless actually in Westlake, and then we have a site in Thousand Oaks, California.
Okay, is there a website, or is that information on the, so if somebody looks up Westminster Free Clinic?
They can look up www.westminsterclinic.org.
Okay, www.westminsterclinic.org. Westminsterclinic.org. And if they search in the phone book, can they find?
Yeah.
So you're listed in the phone book, you're listed on the internet, and if somebody doesn't remember that, they can just search out Free Clinic, and Westminster Free Clinic automatically comes up. That's how I found you. That's how I found you.
And we have a Facebook page and all the social media as well.
Yes. Well, listen, the time has flown. We're just about out of time. So before we wrap up, is there anything that you would like to say to the viewer audience before we say our goodbye for today?
Well, I just want to thank you for this opportunity, and it's really amazing the people in our county and the difference that they want to make, and the difference it makes in the future of young people, that they can then, half of our students are from the patient population and they're going to college for the first time, and it's just because of local people who are caring and want to mentor those students that's possible. So we're very thankful.
Yeah, there's success after success after success about kids from families that didn't finish 3rd grade, 4th grade, that are now in Stanford Medical School, that are medical doctors. Your journal, your newsletter that you pass out just shows endless successes. So thank you. We are out of time now. I'm delighted that we had you here for today. And I'm delighted that we had Lisa come with us from the Westminster Free Clinic. My name is Paulette Mahurin. Until we meet again, keep on watching OurVentura TV. Thank you all so much.